I raised a question. I wanted to know if the councillors on the LAC committee can comment on issues that we've got relating to poor access to GP surgeries in our area. If there's anything that could be done by the LAC councillors within the council to seek ways of making clear what expectations people in the area can have of their GPs in terms of appointments and ability to talk to a GP. For a lot of people in this area, getting access to a GP surgery or getting access to a GP at all is proving extremely difficult. If they can get an appointment, and I've certainly heard many people complaining of endless periods waiting on a telephone and then being cut off before they get to the top of a list. But if they can get there, they don't get any assistance. They almost never can get a face-to-face appointment, and many, particularly older people, are uncomfortable describing things in detail to a faceless telephone. And if they get an appointment, normally they're told it will be at some time between 10 and 12 a.m, for instance. Working people find it extremely difficult to make vague times like that, and it's quite hard for people to fit in with it. There is a feeling that this is not something which is universal across Sheffield, that it's better in some areas than it is in others. It's better in some areas within the north, within West and East Ecclesfield, than in others. But certainly there's a feeling that it's a lot less good in the north of Sheffield than it is in the south and the west of the city. So what is there that the councillors can do to try to help and ameliorate this situation?
Could you raise your second question, Mike, and then we'll take the first question and the second question.
Okay. Well, I was only going to raise the one, but there is a second question, yeah, which is whether the council can confirm, if the councillors, I'm sorry, can confirm, if an undertaking was made when Thorncliffe Leisure Centre was built, that the council would resurface the road. It's an unadopted road, and our understanding, my understanding, is that a commitment was made to residents at the time that in return for the damage that was done by the construction traffic when the centre was being built, that the surface would be restored and made into an acceptable standard. Get that confirmed, and is it, if so, is it possible to get the work actually done?
Yeah, thanks, Mike. Yeah, take the first question first regarding doctors. I think during COVID, certainly in the first year, first 18 months, it was very difficult. Doctors were under immense pressure, surgeries were under immense pressure with staffing and work that they had to commit to. Certainly in the north, it was varied, but my experience over the last 6 months is that the services and appointment systems improved very quickly. As you say, it depends on which surgery that you align to. We have had problems in High Green, which Councillor Whittaker attended to and corresponded with and talked with the providers. And they admitted themselves that there were problems, but hopefully they will have been passed. One of the issues up there, it's two surgeries that are linked, which is the High Green surgery on Thompson Hill and the surgery on Burncross Road, the two linked surgeries. The Burncross Road was closed for appointments and doctors because it was designated initially as a vaccination centre. So all the patients were transferred up to High Green, and they had problems with staffing, COVID, etc., etc. I don't know what the situation is now. Anne, would you like to comment on that, or before we move on with that one?
Because of problems that people were having getting appointments going back a bit, I did get several complaints about the practice in High Green. I then contacted the well, the first thing I did was speak to the practice manager there, who detailed a very difficult scenario. He said that they got over 2,000 phone calls a week. He also said that because appointments were difficult, that the staff came under a lot of abuse. So they then had staffing issues because staff left They didn't want to come to work every day just to be abused. So they left. And then he said that word gets around, it's on social media, so nobody wants to apply for the role when they've got the vacancies, so they can't fill vacancies. They'd had a doctor retire, they'd had a doctor go on long-term sick, they'd had a doctor go on maternity leave. Also, as Councillor Hooper said, they were very much ingrained in the other practice doing the vaccinations. And on one hand, they were getting lots and lots of praise about how they were doing the vaccinations. And on the other hand, getting lots and lots of criticism about their appointments. I referred it to the Sheffield Clinical Commissioning Group for their take on it, and they sort of said that, you know, the level of services in most GP practices throughout Sheffield far outstripped, you know, that the demand far outstripped the supply, and that they were working alongside practices. And they did admit that Chapel Green was, you know, was one that had been highlighted that did have, you know, major problems, and that they were working alongside them to try and improve those problems. Also, the practice manager said that when they have to have locum doctors in, those doctors don't have anywhere near, because they don't have a vested interest in the practice, then they don't do, you know, they're not prepared to put as many hours in and things, and that can cause issues. But I think they are working with the Clinical Commission Group to try and improve things. And one of the things the manager did say is that, you know, he was very well aware that they were not working properly and that things drastically needed to improve, and that, you know, everybody was doing their absolute best, but it didn't help when they were constantly coming under a barrage of sort of, you know, insults and, you know, and anger and abuse and things from the public. I think the practice manager had asked the Clinical Commission Group for help, but they were not in a position, due to funding, were not in a position to give them everything they needed in terms of help. And I think moving forward, they're hoping that would improve. And I think things in general, just very recently, I've had a few people who've given me really nice experiences at Chapel Green practice, which is really good. I had a lady a couple of days ago who told me how wonderful the staff were and how wonderful the doctor had been, you know, how kind the doctor had been to her. And I thought, oh, how nice that instead of people complaining. So hopefully, you know, as we go on and we come further and further out of the pandemic, that things will get back to some sort of normality. But I think in general, you know, the NHS is struggling, isn't it? You know, you think hospital appointments and how long people are waiting, or if you go to A&E, how long you're waiting. You know, there's great difficulties all over, isn't there, in the NHS?
Thanks, Anne. Thanks very much. Councillor Groker, you've got your hand up. Do you want to comment? Julie?
Yes, I may, please, Chair. Thank you. Thank you. I actually took the liberty of contacting a GP who actually works in Woodhouse, but he's on the Clinical Commissioning Group that Anne's just been mentioned, just to say, could you give me some general feedback about the state of GP surgeries across the city, please? I'll just read out the email he sent back to me this afternoon. And he said that because of the national direction about not increasing GP numbers, many of the additional roles in GP's practices, physiotherapists, occupational therapists, pharmacists, paramedics, mental health workers and others, all now do parts of what the public think to be traditional medical practices that should be done by GPs. And he's saying, along with the ever-increasing skill sets of the existing GP team, e.g. roles of advanced nurse practitioners, prescribing nurses, physicians associations and healthcare assistants. So there's a larger group of people who are now doing those what we would all consider traditional GP appointments. It says, prior to the pandemic, there was a move from the Secretary of State for Health to move to a more general practice to a virtual model. And the infection and prevention and control measures of the pandemic have accelerated that move across England, so that we all now work in a way that consults by phone, text, email, video calls, as well as in person. So this apparently was something that was starting before we got the pandemic. We've also separated patients with COVID symptoms and COVID positive, and those with other issues into hot hubs to keep them NHS and the NHS safe, allowing practices to run as cold sites and to see patients with non-COVID issues. And the point that you made, Mike, about the time, they said, along with this locally, a number of practices have put in place appointments with GPs and other health workers out of the traditional hours of 8:30 to 6:30, making them cover now evenings and weekends. So there is a lot of work going on, but I think the thing I picked up from this was the way that we've all traditionally thought there's something wrong with me, I'm going to go into the doctor and get it seen, is not the way that the NHS is moving, and that, you know, the phone calls and what have you will become more and more a routine way to actually access seeing a GP in future. So hopefully that's helpful. I do have regular meetings with the CCG, so it is something that I will, you know, try and keep on top of with them. Thank you, Chair.
Thank you very much. Thank you. Mike, regarding your second question, it's Mortimerley Close, which is the unadopted road, the cul-de-sac that leads into Thorncliffe Park. I don't believe that the construction traffic use that entrance. They may have done at times, but it would cut across the park, which wasn't touched. But all the construction traffic, as far as I'm aware, was down Packhorse Lane. So what I will do, I will forward this into the relevant people in the Sheffield City Council to look at the agreement when it was drawn up, and this would be some 6, 7, 8 years ago, when the undertaking was taken to build the Thorncliffe Leisure Centre and the Sports England football pitch. So I'll come back to you and get some written response to that for you, Mike. Okay, thank you.
Thank you.
I'll take your question now,